Have you been told that your child has a learning problem or trouble paying attention? That might be a misdiagnosis.
The real problem could be their eyes, even if your child has 20/20 vision. CBS 2's Dr. Max Gomez says that this problem starts in preschool.
Well, that's right. You know, in 20/20 just means that they can focus on a distant eye chart. But to be able to read and learn effectively, both eyes have to work together. And whether it's eye coordination or glasses, a new report finds that tens of thousands of young children are struggling with eye problems.
The words were just floating out of order. I could see double of them.
Tell me when it becomes two separate rows of letters.
Kyle Rivera needed glasses, which did correct his vision to 20/20, but he was still having trouble at school.
In school, they started to communicate to us that there was a lack of attention, so he would lose focus a lot.
They may be misdiagnosed with a reading problem, a learning disability, some attention problems, when in fact it may just be a visual issue.
7-year-old Peyton Giffis was diagnosed at age 2 with strabismus, a misalignment in her right eye that forced it to turn inward and required corrective surgery.
The circle or the square? The circle. Good job.
It was scary. It was definitely scary.
What letter do you see?
Since then, Peyton has been getting annual comprehensive eye exams, which Dr. Sasha Blazer says go far beyond the simple eye chart test at school or in a pediatrician's office.
If a kid can read far away, they usually pass those eye tests. But when it comes to reading up close, they might have major difficulties that would not be detected. The words might look like they swim around on the page.
A recent study published in JAMA Ophthalmology finds more than 174,000 preschoolers have vision impairment, and the problem is growing. Not surprisingly, parents tend to blame all the time kids spend looking at electronics these days: phones, tablets, TVs, and computers. Screen time may be a factor, partly for too much up-close focusing, but also because it's all done indoors. Seems that sunlight slows or checks nearsightedness for reasons that aren't clear. Now, if your child covers one eye while reading, complains of double vision, headaches, or gets tired while reading, get an eye exam. The key is early detection. The American Optometric Association recommends that first eye exam as young as 6 months of age.